है बोलो।
So, hello student, I'm Dr. Naseem of BDS. Today my topic is cervical plexus. As you know, cervical plexus are formed by the anterior rami of the spinal nerves. So our topic is cervical plexus, which is formed by the anterior rami of the upper four cervical spinal nerves, that is C1 to C4. These roots they are connected with one another in the form of loops, from which the different branches they are coming out, and they are going to supply the muscles of the neck, and some cutaneous branches are also produced by them, formed by them, which are going to supply the front and back and side of the neck. These now we come to how the cervical plexus is formed. You can see in figure 1, okay, there is C1. C1 means the first cervical spinal nerve, because C1 also stands for the first cervical vertebra. So C1, the anterior rami of C1, C2, C3 and C4 they are going to the anterior rami. The plexus are always formed by the anterior rami. So they are formed by the anterior rami from C1 to C4, and they are going to supply the skin and some of the muscles of the neck. So this is the formation, and this you can see in the figure 1. Then we come to the relations. So the important relation is the posteriorly lies the some of the muscle like levator scapulae and scalenus medius, while anteriorly is the prevertebral fascia, sternocleidomastoid and the internal jugular vein. Sternocleidomastoid is the important relation on which it gives many branches. The plexus they are arranged in irregular series of loop, and then this arrangement it results in the supply of cutaneous area by the branches of more than one spinal nerve. The branches supply the skin of the back of the head and neck and shoulder, and also certain muscles of the neck together with the diaphragm. So we come to the branches. Okay, how the branches they are. Two types of branches they are given by the cervical plexus. The one group is superficial, which is also called the cutaneous branches, and the second is the deep branches, which are called muscular branches. So the superficial cutaneous branches, they all emerge near the middle of the posterior border of the sternocleidomastoid. So the sternocleidomastoid muscle is a very important relation with it. So they come from the posterior border of the sternocleidomastoid muscle on the middle of, and they communicate with themselves. These cutaneous branches, they also communicate with the dorsal rami of the other spinal nerves, and some of them they are going to communicate with some of the cranial nerves. So the four cutaneous branches they are given. They are the first one is as you can see, the lesser occipital nerve. Its root value is C2, and it supply the posterior part of the neck and behind the auricle. The second one is the greater auricular nerve, the root value of which is C2 to C3, and it is the largest trunk which is passing almost vertically upward over the sternocleidomastoid, and it is going to supply the skin on the face over the angle of the mandible and parotid fascia and gland, and some are part of the auricle and skin over the mastoid process. Then we have the third, which is called the transverse cutaneous nerve. It is also called anterior cutaneous nerve. The transverse one is also called the anterior cutaneous nerve. The root value is C2 to C3. It is going to perforate the investing layer and divide into ascending and descending branches. And they supply the skin from the front of the neck, from the chin up to the sternum. The ascending branch of this, it also communicates with the cervical branch of the facial nerve. And the last one, which is the cutaneous, is the supraclavicular nerve. The supraclavicular nerve, the root value is C3 and C4, but mostly it emerges from the C4 at the posterior border of sternocleidomastoid. And soon after it is given by the cervical plexus, it divides into several branches, and they are distributed into three groups. medial group, intermediate group, and then the lateral group. Medial groups supply the skin as far up to the sternal angle, while the intermediate group, it supply the skin as far as down the second rib, while the lateral group, it supply the skin halfway down the deltoid and pass posteriorly as far as the spine of the scapula. So these are the cutaneous branches. Now we come to the deep branches. Deep branches are the muscular branches, which you can also see in the figure 2, the muscular branches, and they are given segmentally to the prevertebral muscles. They are, if you can see the figure 2, they are given to different muscles like rectus capitis anterior, rectus capitis lateralis, longus capitis, then sternohyoid, sternothyroid, and then the inferior belly of the omohyoid. The infra muscles, they are supplied one of its loop, which is called ansa cervicalis, which I'm going to explain later on. That supply, then it is going to supply the sternocleidomastoid along with the 11th cranial nerve, trapezius, along with the accessory nerve. And it also going to supply the levator scapulae. The root values are given in the diagram. You can see it. Then a branch is also given by it, and that is the phrenic nerve, which is going to supply the diaphragm. That part is going to supply the diaphragm. Then one of the other muscle, longus colli and scalene muscles, they are also supplied. Along these all muscles, they are supplied by the cervical plexus along with the brachial plexus and then the accessory nerve. Then, as I told you before, it also gives branches or join the some of the other nerves. These nerves are the cranial nerves, 10th, 11th, 12th, mean vagus, hypoglossal, and then the accessory nerve. Then to the sympathetic gray rami, they pass to the superior cervical ganglion to root of C1 to C4. Now you can see that a loop has been formed, and that loop is called ansa cervicalis. The second name is ansa hypoglossi. It is also called ansa hypoglossi. It is a nerve loop. You can see the loop, and it lies superficial or in the anterior wall of the carotid sheath. Carotid sheath is a layer of the investing layer of the deep cervical fascia of the neck. So how the ansa cervicalis is formed? It is formed by the fibers of C1 to C3 or may be from C2 to C3. It has two loops, superior loop and inferior loop. So you can say a branch from the first cervical spinal nerve, it joins the hypoglossal nerve. You can see in the diagram, in both the diagram, but more clear in the figure 2, the diagram 2, a branch from the C1, it joins the hypoglossal nerve. But some of these C1 fibers, they leave the hypoglossal nerve and they descend down as the superior root of the ansa cervicalis. This descending branch is then going to unite with the descending cervical branches from C2 to C3, and it is going to, when they are joined together, they are going to form the ansa cervicalis. So ansa cervicalis has two roots. Superior root is coming from the C1, while the inferior root is coming from C2 to C3. And this loop is called ansa cervicalis, and it is lying lateral to the inferior jugular vein, which I'm going to show in the third figure. So inferior root, as it descends downward, it winds around the inferior jugular vein, and then it is joined by the superior root in front of the common carotid artery. These are the important relations. It is lying along the inferior internal jugular vein, and then the loop is formed by the lying on the common carotid artery. So that is C1, C2, and C3 fibers within the ansa cervicalis supply the omohyoid, sternohyoid, and sternothyroid. Other C1 fibers within the hypoglossal nerve. Most of the fibers, they are joined by the ansa cervicalis or they are making the superior root, while the other fibers of the C1 within the hypoglossal nerve leave it as a nerve to the thyroid and the genohyoid, which is also shown in the figure 2. So this is all about the cervical plexus and is the main supply of the head and neck. In the head and neck, some of the lateral part, anterior and posterior part of the skin, and some of the muscles. While one nerve, phrenic nerve, if you can see the phrenic nerve, it is formed by C3, C4 and C5. But mainly the fibers, they come from the C4, and it supplies the diaphragm, serous membrane of the thorax and the abdomen. So I hope you get it. The office of the call. So in this diagram, you can see the relations. The loop is lying over the common carotid artery, while the inferior root it winds around the inferior jugular vein, which is shown in the blue color, and then it is joined by the superior root, and then the ansa cervicals. This loop is lying on the common carotid artery. These are the important relations.